Jeremy, thank you so much. Well, the COVID-19 pandemic has caused all of us to push a lot of things lower down on our list of to-dos.
Health experts now worried about the effects of putting off doctor's appointments. Ashley Sharp live in Johnson City with more on how this could lead to a drop in cancer diagnosis.
Hey, Sydney, Casey, good morning. Well, you might think less cancer diagnosis sounds like a good thing, but actually it's a huge cause for concern because it doesn't mean that there's less cancer. It means that it's going undiscovered, and doctors across the country are saying that's due to the COVID-19 pandemic.
The longer someone delays screenings or preventative medicine, the more likely that they'll present in the late stages of their cancer.
As the COVID-19 pandemic still has the nation by grip, widespread delays in cancer screenings, diagnosis, and treatment have doctors across the country calling new attention to early detection.
The unfortunate thing is, for all of us sitting here, we don't know what the downstream effects of those are, right? So 1 and 2 years from now, what does that look like as far as late detection or late diagnosis of staging?
At the beginning of the pandemic outbreak, Ballot Health reports cancer screenings did have to be canceled and rescheduled when the hospital was on lockdown. But now, even as restrictions are lifted, they are still seeing a decline in people seeking preventative cancer care, which they attribute to the pandemic and fear of the virus. Plus,
I think there's probably a group of people who may have lost health coverage during the economic impact, and maybe they're afraid to seek care because of the cost of the care.
Doctors especially concerned for how the pandemic will impact lung cancer, as diagnosis for the disease, the #1 cause of cancer deaths in America, are down.
It's alarming because we know for any cancer, the sooner we find it, the better we can treat it. It is much easier to treat any cancer, including lung cancer, at an early stage where you're potentially eligible for surgery versus when the lung cancer is already spread outside the lungs, which makes surgery less likely.
Is that something that you think is a possibility that, coming out of this pandemic, we could see more people dying from cancer?
Absolutely. I think that it is a big concern that we could see people dying of cancer as well as cardiovascular disease and other diseases as well, that perhaps people didn't seek the care they needed early.
Ballot urging the public to not fall victim to this pandemic by falling behind on cancer screening and treatment.
We try to stress continually the importance of getting those cancer screenings and maintaining those appointments or rescheduling those appointments if they've been canceled.
Of course, for any cancer, early detection is so important, and Ballot Health stressing right now that their facilities are safe for you to come for treatment, even amid the ongoing pandemic. They are taking those certain protocols to keep you safe. And coming up here in our next half hour, we're going to unpack how this pandemic is specifically impacting lung cancer and why doctors are more concerned about that. Sydney, Casey?